This video is about SSRIs, and particularly, do or do they not work very effectively? So we're going to explore some of the controversy and conflict around this and explore the latest research which speaks to the overall general lack of efficacy of these drugs. Now, I need to give a little disclaimer at the beginning of this video. I'm not a psychiatrist. This is not licensed clinical advice. You should, of course, talk to your mental health care provider before starting or continuing or using or anything relating to this sort of thing. This video is for informational purposes, but I think you'll find it very helpful and pretty surprising, some of it, when you look into some of the publications here. So I'll explain what are SSRIs, and then I'll answer the question of, do they work? What do we know about that? And we'll start to explore some implications for that when we think about our own lives. So an SSRI, what is it? Well, it stands for selective serotonin reuptake inhibitor. These are commonly known as antidepressants or anti-anxiety medications. Of course, anti-anxiety, antidepressant are broad categories. These are one type of that medication. And they increase the extracellular level of the neurotransmitter, it's kind of like a brain chemical, serotonin, by limiting its reabsorption into the brain cells. That's reuptake. So if you break down that word, selective serotonin reuptake inhibitor, it's inhibiting or stopping the reuptake or the reabsorption of the neurotransmitter serotonin. And because serotonin is associated with things like mood, emotional state, and sleep, we tend to think then that by kind of artificially increasing the richness of serotonin in the brain, that you will have positive emotional effects that kind of offset that depression, right? That's kind of the idea of how it works. But let's get into the effectiveness and controversy of this drug. So one of the reasons why this is so controversial is because it's so widespread and it's almost ubiquitous. Huge percentages of the US population, as well as a lot of Western Europe, etc., are on SSRIs. And it's often seen as a first-line defense or first-line treatment for a variety of mental disorders, right? Depression, anxiety issues. And often it's prescribed by family physicians who don't even have a really rich expertise in psychiatry or neuroscience, but rather just, hey, you're having these issues, we'll put you on SSRIs. So we'll explore a handful of studies here. I'm going to reference my note. The first one we'll talk about is titled Response to Acute Monotherapy for Major Depressive Disorder in Randomized Placebo-Controlled Trials, submitted to the U.S. Food and Drug Administration. Individual participant data analysis found that only about 15% derive any more benefit from the drugs than they would a sugar pill. So this is pretty incredible. So think about this. There is this meta study. They're looking at 232 placebo-controlled trials of 73,388 patients diagnosed with major depressive disorders. What they found suggests that the active ingredient in 10 of the most popularly prescribed antidepressant medications make a meaningful difference in only about 15% of the patients who took them. And it was almost always in the patients suffering from the worst depression. So what that means is that all the possible people taking them, it's not that it was like all of them got 15% better, but for that very select group of 15%, they found that there was some improvement. And so the reason that's kind of important is because when you compare the performance of these SSRIs to sugar pills, which are a placebo drug that they use in studies, because what you tend to find is if I were to just give you a sugar pill and you don't know it's a sugar pill, and I'd say, hey, this pill is going to make you happier or make you less depressed, for a lot of people, they show some improvement because it's just the placebo effect that the mind sets kind of an expectation that something's going to get better and it gets better. So what they say is that it's, in most cases, 85%, there's no real material difference between these SSRIs and sugar pills. And it relates back to another study that I'll reference here, the Serotonin Theory of Depression, a systematic umbrella review of the evidence. This suggests that serotonin doesn't really play a material role in depression. So it's not as much a chemical imbalance, but as the lead researcher of that paper says in an article from Newsweek, she says it's not helpful to think of depression as a brain disease. I think we should be thinking of it as an emotional reaction to life circumstances. So in that, also another large substantial meta study, they found that it wasn't so much about serotonin. But if you remember what I said at the beginning of the video when I broke down SSRIs, that was kind of the whole theory, is they said that by limiting the reuptake of serotonin and increasing that balance of serotonin in the brain, you're undoing these depressive symptoms. But they say, no, it's not really about that. So what these two papers start to point out is kind of some of the weaknesses in what has been the status quo, so to speak, in our treatment of mental health for the last 20, 30 years in this country. And I'll touch on a few other papers here. So two meta-analyses, and again, I've used the term meta-analysis a couple times. A meta-analysis is a study of studies. So you look at all the many different studies on a given topic, and you kind of look for a common theme or common takeaway from all of those individual studies. So in this meta-study in 2008 from last name Kirsch, and 2010 from last name Fournier, Fournier, maybe didn't pronounce it correctly, found that in mild and moderate depression, the effect of SSRIs is small or none compared to placebo, again, the sugar pill, while in very severe depression, it has some effect. So this 2008 paper looked at 35 trials submitted to the FDA that came ahead of licensing new drugs, because that's kind of the process, is these drug manufacturers have to submit studies to the FDA that shows that the thing works. And the authors attributed the relationship between severity and efficacy to a reduction in the placebo effect in severely depressed patients rather than an increase in the effect size of the medication. In other words, it wasn't necessarily the medication that was doing anything that substantial. So this one, right, is kind of, two of those are saying, again, what we just said at the beginning of this video, which is that they don't seem to be that effective. Another paper here, 2012 meta-analysis of two commonly used antidepressants, basically said that there was some improvement compared to placebo, but, and this is going to tie into a main idea of this video, is that the authors disclosed financial relationships with pharmaceutical industries. We have another paper here, a 2017 review. It says SSRIs versus placebo seem to have statistically significant effects on depressive symptoms, but the significance of these effects seems questionable and the trials were at a high risk of bias. Furthermore, SSRIs significantly increase the risk of both serious and non-serious adverse events. So in summary, their results showed that the harmful effects of SSRIs versus the placebo for depression seem to outweigh any potential small benefits. So they said it's just not worth the trade-off, right? Of taking these drugs for a chance of some small benefit doesn't outweigh all the side effects. There was a paper published by Frederick Hieronymus, Hieronymus, et al. That criticized this review as inaccurate, misleading, etc. But they also disclosed multiple ties to pharmaceutical industries, including speaking and presenting fees. So in reviewing several of those papers, right, we think about what we talked about, that main study we referenced at the beginning that found that for only 15% of people there was a material difference in outcomes, and then this broader meta-study on the role of serotonin, which said it's really not about serotonin. And then we look at a few more of those papers that call these things into question, and what you'll notice, the reason I mention this specifically, is that a couple of the criticisms of these papers, and as well as the one study that did indicate the effectiveness of SSRIs, both the researchers had fairly material ties that they had to disclose to the drug companies. Now, were they working for them? Were they paid by them? Of course, I'm not going to insinuate that, but typically when you publish something, you have to disclose any material conflicts of interest, and in all those cases, you see ties to the pharmaceutical industry. So the reason I point that out is because we seem to have mounting evidence that these drugs aren't as effective as we would like them to be. And we also see that there's an incentive bias, that these profit-making entities seem to have a pretty material influence on not only the FDA, but on the direction of the scientific literature in general. And a lot of that seems to be shaping the views that are presented by these researchers and scientists. So my final message here, first, is that we need to separate profit and truth, particularly when it comes to psychology and the science of happiness and well-being. right? So I don't know exactly where you begin with that, but it's very important to consider the incentive structures at play here, where you have these drug companies that are designing studies to try to get the outcome they want so that they can sell more drugs. And of course, often their interests are influencing the researchers that we expect to be making objective claims here about what is true when it comes to mental health and mental disorders. The other message of this video is just this: skepticism. That when we look at a lot of these fairly robust studies, we see it's not a broad-based rebuttal or rejection of SSRIs saying they'll never work, they're terrible, whatever, but they certainly are overprescribed. There's a fair amount of literature on that I didn't even draw on in this video. And they may be helpful to a small group, right? But they shouldn't be for everyone, and they should not be the first line treatment or response to any level of depressive symptoms. We should be a little bit more skeptical in if we want to take these drugs or how we want to engage with or prescribe these drugs. So there you have it. I, as always, will include in this video, there's a lot of fairly technical and dense references. I will include those down below, as well as always, my resources, newsletters, and my Living Happiness knowledge base, which you can play around in and find some interesting threads in there. But that's all for now. So here is another video that YouTube suggests you'll like from my channel on the study of happiness. And that's all for today. So, hey, thank you for watching this video. A lot of science there, but I hope it's helpful. And I'll see you in the next video. This has been your happiness nerd, Jackson Kirchis.